permit me to share this experience with us. I open for question, of course. If you like to make a question, I just say before, if you like to give me some question for the other topics, because I know that they put the other topics in there, maybe you like just to ask something about how to manage hypertension or antiphospholipid syndrome or a disease, not any problem. I'm here, I can answer that. Okay.
Professor, yeah. Thank you very much for your talk. How many deliveries do you have annually in your hospital?
2,500. 2,500. It's a OB/GYN department into general hospital, a high-risk hospital. Have a flat for us, and it's a 2,500, and approximately 60% of them are all high-risk pregnancy, maternal problems. The other are generally maternal fetal medicine, or fetal medicine, intrauterine treatments, intrauterine diagnosis for fetal disease. Yeah.
I saw a recent review article, I think in either the Gray or the Green Journal, about causes of ICU admissions in this country, and I was surprised to see how low hypertension was. But then when I thought about it, I realized we see hypertension all the time, but a lot of these patients are managed on labor and delivery and really rarely go to the ICU. So I was just wondering why the ICU rates seem so much different worldwide as compared to at least what we're seeing in the US.
You say that you see very few?
We see a lot of hypertensives, but we rarely send them to an ICU setting.
Yeah.
And so I don't think it's a very common cause in this country, or it's one of the lower on
the
list.
The difference is this, that what I tell you before. In our department, all the hypertensive ladies and severe hypertensive, preeclamptic hypertensive ladies, if they not need respiratory ventilation, they has not a heart problem or difficult shock problem to be managed in intensive care unit, all the other ladies are cared in the special care unit that we have in our department. And I show there only the ladies who are coming to the intensive care unit. There are very few. And also heart syndrome is managed in my department. Of course, with advice and with the visitor for the other doctors that are coming every moment when we just call the doctor for the other department. They are coming many times a day just to see the ladies there. But as soon as the ladies are awake and they can manage without necessity of the invasive procedure, they remain in our department. They are not sending to the intensive care unit. That's what I like just to show here. Okay, but we have many hypertensive disease, and also eclamptic syndrome, and etc. etc. They are coming with really directly with convulsions, because the poor ladies and ladies from the shanty towns, they are not diagnosed before the very last minute. Okay. How many ladies with hypertensive disease you see here? Many ladies every day. Is one of the most important problems.
Pretty much every day, but we don't see so much severe hypertension. We have about 4,100 deliveries a year. And depending on the ethnic population, the frequency of hypertension is 7 to 10%.
7 to 10%.
But the severity we would seldom see in a hospital like this compared to the severity you're talking about, because everyone here in our area has free health care during pregnancy, whether they're U.S. citizens or illegal immigrants right off the bus or the airplane. Everybody gets free prenatal care from the very beginning, and we don't see so much neglect here. So they're in treatment and they're managed through the entire pregnancy, and we have very, very few that deteriorate with, for example, need for severe afterbirth reduction in heart failure. We just don't see those.
And what about activities, for example, the problem in placental implantation?
We have a lot.
You have many of them?
Yeah, our most common true intensive care patient is hypovolemic shock, hemorrhagic hypovolemic shock, which we manage within our own unit within reason. But if she's in profound shock, she goes to the intensive care unit. as all other, we look upon it as a trauma victim.
And this is in great part because of high cesarean rate
You're right.
here. So multiple cesareans, the rate of accreta is much higher,
Yeah.
and then we're taking care of those regularly. Probably have almost one every month. Those.
One every month. Yes, like us. Okay. And you just go hysterectomy, or just you try
Many.
just to, most of them go to hysterectomy, or just to save the uterus inside?
Well, most want to save the uterus, but my impression is about half the time
Half the time.
we will be doing a cesarean hysterectomy, maybe a little more than that.